Yo, yo, yo. Hey guys, welcome back to another amazing edition of the Best Practices Show podcast. Happy Friday, everybody. Hope your week was a great one. On Fridays around here, it's Clinical Edge Day. Our job is to keep you at the top edge of your clinical skills with insights from the top leaders in the industry. And when you're using your brain, are you an artist or are you a technician as a dentist? It's a big question. Well, I brought on two of my favorites, Dr. Charlie Ward and Joshua Polansky, to give us some insight. It is awesome. So please listen up. I hope you guys enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam around here. I get the coolest people in all of dentistry to share some insights, some topics, some hot topics to help you improve your practice and your life. And I'm going to make sure that these guys are regular recurring guests, whether they like it or not. And we just recently did a podcast that you're going to have to listen to that was phenomenal. But this is the follow-up of many. And I've got Dr. Charlie Ward and Josh Polansky on here. We're going to be talking about toggling both sides of the brain. Like, are you a right side brain dentist or a left side brain dentist, or are you both? And I need you guys to tee this up and explain what that means. Who wants to go first?
I'll go first. Charlie? Yeah, I'll start it because I think I brought it up. I was saying I was talking to a friend of mine, Mac McDonald in Texas, about just sort of why Josh and I have had the successes that we've had recently. And what we see in our cases. And I think I attribute that to my ability to be able to tap into the technical side of my brain and the artistic side of my brain. I think we trace this back to my dad. My dad was a mechanic and a contractor, and he also taught me how to draw. And I remember as a kid, putting together models and drawing pictures. I just loved that art side of things, but he could also be mechanical enough to put back an engine on an 18-wheeler. So I think that's where that came from. This is a new revelation, if you will. But I mentioned I think the reason that Josh and I work together really well is that we can see things artistically, where should things be as far as nature's concerned and what makes things naturally beautiful. And we can be technical about, hey, I need 0.3 of a millimeter at this margin and no more here. Or I need a system in place where I can easily follow to make sure my preps are exactly where they need to be, or that I deliver the restorations the way they're supposed to. All of those things. So we're literally tapping both sides of our brain as we're planning, executing, and delivering these cases.
Yeah. Josh, add your perspective.
Yeah, I think Charlie and I, we've talked about this before, but when Charlie first came to work from me, come work with me, he explained to me that oh, you're kind of an artist. And I've heard this throughout my career. I think dentists typically refer to their good technicians or their ceramicists as, oh, he's an artist, or you see it on the lab script, work your magic, work your art. And I was telling you guys this before the show. I mean, when I went to UCLA under Ed McLaren's program, tapping into the right side of the brain was always kind of I would say the hack to becoming a good dentist. You really wanted to tap into the creative side of your brain. And because dental technology is very creative, as Charlie was saying. Dentistry actually is very creative, as Charlie was saying. So we did things like we read these books by Betty Edwards called Drawing from the Right Side of the Brain, and we just used our brain like the muscle it is and tried to train it to see things different, look at negative space. And those were kind of the foundations of me becoming a very competent, good ceramist and dental technician. But I would say that was more of the aesthetic side of dentistry. Everything's ideal, everything's prepped perfectly. This was just making something look very beautiful. I think I had to really start using the other side of my brain, the left side of my brain, once I started doing a lot of work with a ton of like perioprosthodontists and very challenging technical cases where it really wasn't about beauty and aesthetics. It was really about measurements and numbers. So I was always struggling in between the two because it was almost like a fight in my head of like the left side yelling at the right side. And like it was like always this fight. So I had to develop this I guess this skill set to be able to toggle between both. Whenever I look at a situation, and that's not just with my hands or my work, but it's even when a technician comes to me in my lab and asks me a question, I have to think this through either technically or creatively with them and know when to kind of turn their right side off, if that makes sense. Because a lot of technicians are purely right side.
Right.
Like, let's only do this because it'll look the best. And I have to then understand how to kind of like figure the situation out on what side of the brain that I want to use that day. So I do think that you really should master the skills in both. And I think that I am way more analytical than I am creative. I'm sure others would argue on that, but I know that I am a problem solver, and that's purely left side if you think about it from an analytical standpoint. But the thing that I've realized is when I start putting that creativity or my right side, when I join forces, I start then solving problems creatively. So I think that blend of the two has really allowed Charlie and I to make great cases together because we kind of just have discussions like this, like how we're having a discussion now. I mean, we'll just get on the phone and just talk like this out loud. And I always kind of preface whatever I say is, don't take anything I'm saying seriously. Let me just talk out loud and brainstorm. And we just start talking and we just start talking. And then we pick a little from the creative side, a little from the left side. And that's how we work through a lot of our cases.
Yeah.
Yeah, absolutely.
And Charlie, can I ask you a question before we hit the go button? You said, you're not an artist, you're a technician. Now, and you were pointing to, I want you to finish that thought. Like, are you more on the artistic side and you've created systems to help you with the technical part? Like, where were you going with that thought?
So that's interesting. You know, my buddy Mike, and I shared this with Mac, who I mentioned earlier. My buddy Mike years ago told me, let's call it a midlife crisis that I was having at 39 or whatever it was. You know, he looked at me. I was telling him, like, I really want to do more aesthetic dentistry. Like, this is where I enjoy my work the most. And he's like, yeah, that makes sense. You're an artist and a teacher. And I was like, that doesn't sound like me. Like, what? And then I thought about it and I was like, you know, I do the aesthetic things so that I can photograph them so I can show other people how to do it. Like, it's exactly what I am. And I didn't realize that until then. So am I more of one than the other? I think I was artistic before I was systematic.
Maybe we should judge each other. Maybe I should answer for Charlie.
Yeah.
Answer for me.
I like that.
Please, just go there. Go there.
Yeah,
yeah, because I'm thinking about it, and I gotta be honest with you, I'm kind of stumped on that. I mean,
that's a good question.
If I had to nail it down, I think Charlie is more of an artist.
Tell me why.
I think so.
Tell me why.
Yeah, because there's a lot of technical there, but I think you know, when Charlie sends me after pictures, for instance, he sends me photos that we just don't get from other dentists. And it's not because those other dentists don't have the camera and the capabilities to do that. I think he sees things more like me or more from like a different perspective. Like, this would look good from this angle as opposed to just the straight on. I've also seen some of the temporaries Charlie makes. He puts in just that extra work to make them look better. And I think only an artist would do that, because for an artist, I think a great work is truly never done. Like, it's just never done. And for us, we have the luxury of going home and letting it sit on a bench and coming back and looking at it with fresh eyes. But I think a technical person would just load the temporaries in, look at it, and clean it up real quick and be like, you're good, and then send them home. Whereas I think an artist steps back and looks at things, So I would say that Charlie's both, but for me, I feel he errs more on the creative side. Um, my
Yeah.
opinion. I don't know if anyone else would think that, but that's what I would think.
I think that I would totally agree. I mean, I never heard someone say that, but like it's never done. Like I could sit there all day and fiddle with it, whatever it is.
Yeah.
And I have to finish it because I have something else to do.
He also experiments. Like he'll send me a case and it's like I saw what he was trying to do. And I don't want to say he butchered it, but it might look like the stain sometimes looks all like dark and crazy. And he's like, I just was, I don't think an analytical person would even attempt that, if that makes sense to you. So um, I think he wants to push more of the creative side of what he does. I think. Whereas maybe if you asked a technician in my lab, they might not say that because they only see the technical side of Charlie. They only see his preps and his articulations. So maybe if I went outside and said, is Charlie more creative or technical? I think other people might say he's more technical. I'm going to say he's more creative because I have these discussions with him. So I hear the process. I see the process.
Yeah. Can I ask you guys a question on that very subject? So many years ago, through the Pankey journey, Mike Fling, who's a great mentor of mine, introduced me to a guy named Dr. Bill Lockhart. So he was one of the classics. And I went to his house and all that kind of stuff. And he said something to me I never forgot. He's like, Kirk, perfection is actually deadly in dentistry. Excellence is a great goal. Perfection was God's job. There were days where it was perfect, but it wasn't my doing. Can you guys speak to your definition on, because we do see it. Like when you see something at a course, it's hard to not see it. When you see imperfections in your own work, it's hard to not see it. What's the word perfection mean to you? And put that in good terms for us.
It's dangerous.
Yeah. You take it first. I don't want to say too much.
It's so hard because you're right. The more that I learn and the more I want it to be better, the more I see the flaws. And that's what's making it more and more difficult. I had this conversation the other day with, Josh and I talked the last time. We have this case, it's going to be on the cover of this magazine. And like, I don't know how to do better than that. But throughout my life, my expectation is that each case is better than the last case. But I may have reached a point where I have to figure out what excellence is because I don't know where to go. And that's not to say I'm done learning, because I'm not. I've got things that I want to improve, but I'm like, I see something where my preps were great and my provisionals were great, and Josh and Yolanda made beautiful final porcelain. Like I don't know how to go above that, and I feel like I'm starting to drive myself crazy figuring out what I'm going to change to do this better. So can I now reframe to say, okay, this is what excellence looks like. How do I match this every time? I don't need to make it better than this. I need to meet this. Because the perfection part of it, there was a point I think that I was driving myself crazy trying. I do it now. I mean, we have a case that we did on a good friend of mine.
Knew you were going to bring it up. Yeah.
It drives me nuts.
For me, I like it. And that's where perfection for me becomes very dangerous. And that's what I would try to tell Charlie, because Charlie, long story short, beautiful case, all anterior, feldspathic veneers, and the mesial embrasures between 8 and 9 are not exactly symmetrical. And Charlie keeps telling me I'm gonna make them symmetrical. And I keep telling him, do not touch them. And we go back and forth with this forever. And for me, I also used to strive for perfection. And the only thing that it did for me was lead me to burnout, smoking, drinking. Charlie been there through all of this. Perfection is deadly. It is, I would actually say striving for perfection is dangerous. It is dangerous. So I think what Charlie said is very important, where you have a bar that just keeps getting set. And at some point, when you're like really deep, like 20 years I've been doing this, I'm deep enough to know, and I've seen Michel Monier's work and Geller's work, and I'm a very open-minded person. When I see good work, I don't shit on it. I say, oh my God, that's amazing. So like I keep taking in what I think is perfect, and then I keep trying to, I guess, make subtle little changes to try to make it better, but I'm not striving for what I used to deem as perfection because, in all honesty, this isn't like a cliche thing. It does not exist. It
Right.
does not exist. It just doesn't exist. And you have to be mature enough to understand that it doesn't exist. And I think, I don't want to like say this, but for a doctor, I think striving for perfection is a little easier because their preps get covered by our work, but our work is out there for the world. So like when we look at our work, it's hard, like you're naked to the world. So if you see something's off, it's off. And that's why I see what Charlie sees in this case. I do, but I just think it looks good. I just think it looks good. And I think once you start sacrificing excellent for perfection, that's when you make mistakes. He'll go to do it, he'll make it worse. The patient will say, oh, I used to like how it was. And now you go down a rabbit hole if you have to remake them. Now I get angry. So it just gets crazy. So I think we have to be mature and know where to draw the line. I think we have to know where to draw the line. The problem is, I think for young dentists is they haven't understood where that line is yet. And that's where like that chaos evolves. So when I say that perfection is dangerous, I would follow that by saying you should probably go through a period of not torture, but like you should feel pain until you understand where your bar is. But you should set a bar for yourself, I would say.
Yeah. So let's take those two lines. Let's take the first concept.
Hold on. What am I? What am I, Charlie?
What are you? Yeah.
I think Josh, thank you for bringing that back up. I always saw Josh as an artist that became a technician through, I'll say necessity, exactly as he described it, right? Like he artistically, I like the way he put it, like we see things through a certain lens or a certain perspective. So like when I'm taking a photo of something, I think Josh sees things similar to the way I see them. I think just as I became more technical to make my systems better, he had to become more technical to deal with the type of cases that he was doing. It wasn't all single centrals anymore, that he was hand layering 15 single centrals to get the right one. He was trying to figure out how to deal with a hybrid that was fracturing. And we need to know technical information about thicknesses of materials and torques and screw size. Like all of these things are not artistic anymore. So I think adding that, and I don't know if that's the right, is that the way people normally do that they are artistic and then it's maybe easier for an artist to be more technical, or is it easy for a technician to be more artistic? I don't know, but I see him on the same path that I was on.
I think also that we both had to be technical because we both own businesses, and I think that running a business from a creative side only could become very detrimental because you're running things with your feet. Our artistics have a lot of we have a lot of feelings. We always feel a certain way, and in running a company, I think that would be a problem. I know a lot of technicians who run their business off their feelings, and unfortunately, they didn't really work out. So at some point, the analytical side has to kick over, kind of like, and take over. So I think Charlie and I, we cease to mention this, but as we've worked together over the last however many years, we both kind of went into business also at the same time together. And Charlie's grown to a bigger practice and with more associates. I've grown to a bigger lab with more employees. So I think that that's another reason our left side kind of built out of necessity. Now, that was kind of a survival thing, like sink or swim. If I don't think like this, I will probably go out of business.
Yeah. Josh, your assessment of Charlie's assessment of you. Was he pretty
accurate? Yeah.
Was it accurate?
I think so. Listen, I know I think I think I'm more creative because I enjoy creativity. I don't enjoy analytical stuff. I don't enjoy Newton centimeters, and I don't like. I know it all, but I don't. I don't take a lot of like. I don't know. It doesn't like get my juices flowing. Whereas creativity still gets me excited, and not just in the dental world, but just like I love art. I love creativity. I love seeing things differently. So I think I'm more creative. However, I I think I used to be way more creative. I think that the adult may have kind of entered the room with me and kind of keeps me. There's a dialogue, and I think there's an adult that now keeps me on a leash where he knows I used to be free, like free, free, free. And I know now that people depend on me. I have a team. I have a lot of people that look at me. They look not up to me, but I mentor people. I have to take it more serious. So although I enjoy being more creative and saying what I want, doing what I want, and acting like I want, I think there's also the left brain kicks in and tells me kind of like squash, calm it down a little bit. So I guess
I think, yeah, it's interesting, like why we would become more technical. And I think as I'm hearing Josh say that, I'm sure I became more technical the longer I owned my business and the more I wanted that to grow and be successful. I think that from like a chairside dentist perspective, like I wanted to be better, and I think I realized two things. I wasn't going to do the things to the level that I wanted to do them unless I became more systematic, right? That I would have the most control if I could be more systematic. And then that also allowed me to be able to teach it to other people because I can then conceptualize what I was doing. And I feel that's another thing I probably learned from my dad, that like I feel like I understand concepts well, right? Like if I can understand conceptually what we're trying to do, then I can troubleshoot anything, right? So if I understand conceptually that I need to get these provisionals to lock into place in the shrink wrap technique, then how do I do that? And if I can systematize it, then I can take that to Pankey or to a lecture or wherever it is, and actually teach people a way that they can go back and then implement, right? So I think it was born out of trying to be that person that my buddy Mike said, like, if I'm going to be an artist, I can be an artist and I can do all these creative things, but I can't teach like what I see through a camera. There are some things I can teach, but my perspective, I feel like some of that's personal and what I believe is my own aesthetic, right? Like, what do I find to be beautiful? Or what do I want to show? I can teach you the settings on the camera, but I can't teach you to see it how I see it. So I think it was born out of that piece,
I also think, Kirk, to kind of piggyback off what Charlie's saying, it's weird when you start hearing other people say things. Like I'm seeing also another reason why I think what people need to have in order to kind of execute both right and left sides. And I think that I have it, I think, and I definitely know Charlie has it because I've been around him a lot in front of patients. But it's not just a creative and a technical. There's also, I think, a very big emotional component to this on how to actually have this inner dialogue and then extrapolate that to the public. That's your patient, that's your team member. And I think that Charlie, and I can't speak for Charlie, but I know there's always like this, like, you ever hear this book called like Blink? I forgot who it was
Yeah,
by, like
Malcolm Gladwell. Yeah.
Oh
Yeah.
yeah, Michael
Well,
Behrendt.
I always think about that like these people make these like decisions in like a nanosecond, And if I think about it, I know when someone brings me a problem, which is also one of the reasons why we became so technical out of necessity, is we are not artists by nature. It's what we want to be when we make teeth or when we be a dentist, but by definition of our job, we are problem solvers. People only come to us with problems. Making teeth is a problem. That patient went to Charlie because it's a problem, and we have to solve these problems. So when these problems arise, I feel like our right and left just have this crazy fight inside, and it's like a nanosecond. but then our emotional intelligence kicks in on how to explain this to somebody to not only get what we want, because that sounds very manipulative, but we can explain it in a way to guide it towards what our decision was. Where I think if you're, I hope this makes sense, but if you're just like an emotional person, you kind of just yell something out, it might be what is the reality, but now we're not on a path to solving the problem because now you just scared the patient. Now that like, or you just yelled at the technician, and now like, so you have to have an emotional component that I think is the glue between the right and the left to be able to kind of move with the world in order to solve the problems that you're tasked with every day. I hope that wasn't like super deep, but when Charlie was saying that, I was thinking about Charlie with patience and solving problems, but I've seen the way he handles people and his team and his and the patients is kind of how he is also allowed to be creative, if that makes sense. Because like in order to be creative, we have to be able to do what we want. But we don't live in an isolated world where it's like Lord of the Flies, where I'm alone on an island. In order for me to do what I want, I have to have people believe in me and want to do it with me. So I have to be able to have the emotional IQ to get people on the same page that I am in order for me to solve your problem and be the creative person I want to be. I hope that wasn't too deep, but I just went off on a tangent.
You were speaking right into my soul because I'm more on the emotional side. And so I have so many people around me trying to help me be a better human being. But I've learned the hard way between stimulus and response, the more space I give, the better the response, especially being married to an amazing woman for 25 and a half years. I've learned, don't say anything. And so I use an acronym, WAIT. Why am I talking? Just calmly, don't talk. Take it in, then collect my thoughts because it comes out better. It comes out less responsive, less emotional. You actually become a more calm person by doing that. So I don't know what that layer is between the brains, but I think you guys are on to something. This is huge, man. So I love this.
The acid I took when I was younger.
Every time I'm on with you guys, I get a new like thought process that I'm totally going to borrow from you and share with other dentists. Like now I know here's what's really cool about these guys. Josh, you have a very, very important event. He's got a pickleball game he can't miss. So like we got a hard stop here, but I want to finish with this final thoughts. I always want to do final thoughts. Who wants to go first?
Josh.
Charlie, go for it. I talked. I talked.
All right. Okay, I'll go first. Final thought. Do you have a question, or am I just going for it?
Just wrap it up. Like I always like anybody listening, like summarize and give us some final things to think about.
Yeah, I think I'll say two things. I started to say this. Josh was speaking there. Part of the reason that we can have very different personalities and work together so well, he talked about that at the beginning, is we have a common goal, right? So I have a common goal to help the patient. Josh has a common goal to help me, but we both want to create something excellent at the end, right? So I know that no matter what's happening, if I'm in a bind with something and I call Josh, he keeps saying solve the problem, but he wants an excellent result, just like me. So he's not my enemy. He's my ally, right? So like we don't fight about stuff. If I have a problem, I call him because he wants to make it right. So I think some of the issues people get into with either technicians or team members or whatever is, being clear about what's your common goal here? Like, what are we working towards? What's our mission, right? What's our mission statement as a practice? What's our mission vision as a team that's working together? And Josh and I are certainly a team. So if you have a technician who's blowing you off and not giving you the time of day and you're trying to improve what you're doing, you need to find somebody else, right? Because you don't have shared values here. And Josh and I have shared values. The other piece of that to me is I think so many of us in dentistry, we're analytic people. We had Chris with us last time. And he's a chemical engineer by trade. He's a very technical person, and most of us in dentistry are very technical people. But that emotional component that you have to work with people is part of that. The fact that you're dealing with such an emotional part of the body, not just what it shows when you smile, but also that people are very vulnerable when they have to allow us to work on them. So if we're not using that right side of our brain that is creative and emotional, and we're only using the left side of our brain, at some point, we're going to have issues that are difficult for us to deal with. So we got to tap both.
Love it. Josh.
Yeah, I mean, I'll make it kind of quick. Charlie summarized it pretty well, but I would say kind of look inside of yourself. Everyone kind of has their strengths and weaknesses. And I would say look to other people to help define what your strengths and weaknesses are, which is pretty hard because you have to be vulnerable and take some criticism. But you don't really see yourself. So I mean, like we were talking about our wives earlier, my wife has definitely pointed out things to me that I can work on. And I think that once you hear them, you have to look and say, okay, creativity is my strength. So I don't need to work on that. But I do have issues like with frustrations when it comes to solving problems. So look into working on that. And that's how I think I changed, was kind of recognizing where my weaknesses were and being open enough to work on my weaknesses. And I think that what Charlie said, I can tell you, I don't want to stereotype as a whole, but a lot of doctors are very analytical and they just want to know why that happened, but why that happened, but why that happened, but why that happened. And at one point you're like, dude, it's because it's human error. And that is more of like the emotional response. But you need those people to also say, okay, maybe it is human. And it was like, you just have to be able to know who you are, define yourself, I guess, and be open to working on that, I would say. I guess that's my final thought. And then also just work with people that you kind of like click with. I mean, like, you don't want to force anything. A forced relationship in any part of life doesn't sound fun to me, whether it's personal or professional. So I would say that, you don't have to be, I mean, Charlie and I are close friends. That's the cherry on top. But I have tons of clients that I talk to all the time. We're all good. And we don't talk every day, but we're good. So I would say also try to work with specialists that you can connect with on multiple levels.
Yeah. I have absolutely loved this, you guys. Now I know you got to run. One last thing. Just tell us, Josh, I want both of you guys to do this. Josh, Charlie, people are listening to this. I know they're going to want to find out more about you. Where do I go? How do I find out more about you? What do you do?
Me or I'll tell you.
You go first, Josh.
Yeah. I own Niche Dental Studio. It's in Voorhees, New Jersey. It's a very Googleable dental lab. So if you either Google Niche Dental Studio or Josh Polansky, you'll see a ton of information on us. Where you want to see the majority of our stuff is on Instagram. We kind of daily update everything, and yeah, you can see what we do there.
Awesome. Cool. Yeah. Charlie, where do people go to find more about you?
Yeah, so our practice name is Baltimore Dental Arts. We're in Baltimore, Maryland, just outside the city. I work with my partner, Devin, my wife, Melody, who's a periodontist. If you want to see us, you can check out our website, baltimoredentalarts.com. Lecturing a lot at the Pankey Institute, so pankey.org, of course. You can check out videos that I've done on Restorative Nation. Restorativenation.com has a lot of technical stuff on there, photography, veneer preps, all kinds of good things. And then I'll be in Texas this summer, Southwest Dental Conference, doing a photography course with Chris Mazzola, and some other things throughout the fall. So check us out.
Awesome.
Let's see some people there.
I've absolutely enjoyed this. Josh, you can run at any time, but stick around while we say goodbye to everybody else. If you're not taking notes, don't worry. I'm taking notes for you. You can flip up to the show notes. There'll be links to everything Josh and Charlie have shared. You can just click right on them and check them out. So keep tuning in. I'm going to have these guys back again and again and again. And until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.